along with the fat loss.
So the question was, can you actually transfer fat into the face rather than using fillers?
I have enough to transfer.
There's actually donors. We have a waiting list of donors. But, first of all, that's a great question, and the answer is yes. Fat, it turns out to be a very interesting cell of the body. In fact, it's a stem cell. A lot of you have probably heard that term, stem cell. It can actually even improve the overlying skin if there was damage, severe damage to the skin. Not completely, but to some extent. But it's great because it's a great time, and more this is one of the ancillary procedures I was mentioning that we do, and we recommend it often. The reason it's a great question is, it's true that as with time and gravity the tissues sag, you also tend to lose volume in your cheeks. And of interest, it's not just these cheeks, it's on the side of these cheeks too. But there's other places, simultaneously, fat cells in other locations. They must have receptors, we figure, because in other locations, in a woman, in the cello or pear-shaped distribution, in a man, the spare tire distribution, where the fat cells tend to grow. And we can take fat cells from those areas and transplant it, and when they're transplanted, they always remember their home address. So they tend to keep their volume up. And so it's a great thing to do, and sometimes it even requires more than one injection because the fat cells that are native there tend to fade with time. But it's a wonderful thing to do, and that can be done at the very same time or later. And that's a wonderful question, and it's a great thing to do. You know, the sign of youth is like an egg. And when you're early on in life and younger, the skinny side of the egg is down. And then as you get older, it goes the opposite direction. And that's just with gravity. So it's not just the loose skin and everything as well, it's also restoring the volume up high on the cheeks. And yes, it can be done, it's a wonderful thing to do.